Good afternoon, everyone. I shall be discussing development of a predictive model for achieving zero failure rate in macular hole surgery with no financial disclosures. Macular hole was first described by Knapp and classified into 4 stages by Gass. Kelly and Wendell did first of all vitrectomy. Causes could be trauma, myopia, or VFT. These are the 4 stages of macular hole. And in surgery, we do removal of the vitreous, posterior hyaloid, ERM, ILM, and use of adjuvant techniques is done. In our center, we did a retrospective study on 107 eyes of 107 patients, and sutureless vitrectomy was done in them for full thickness macular hole. And we studied best corrected visual acuity, fundus photo, OCT. And on OCT parameters measured were stage of macular hole, height, base diameter, minimal diameter, macular hole index, diameter hole index, tractional hole index, and hole form factor. And we observed that the mean age of the patients was 63.28 years, 71 were females, and the patients were followed up for 9.2 months. And 71 patients, they had grade 4 macular hole. The visual acuity increased from 636 to 618 post-operatively. 101 patients, they had type 1 closure rate. And we observed that when the macular hole index is less than 0.3 to 0.35, if we do conventional procedure, the holes remain open. And if it is more than 0.35, the hole will be closed by conventional or ILM flap procedure. And in tractional hole index, we observed that if the value is less than 0.6, and if we do conventional procedure in them, there was type 2 closure of macular hole. And not a relevant association was seen with hole form factor and diameter hole index. And if we do whether the ILM flap or conventional procedure, the hole will remain closed post-operatively. So based on results, we have developed a predictive model on the OCT parameters, which indicate that tractional hole index and macular hole index, they have strong correlation with surgical outcome. And if MHI is less than 0.3 and THI is less than 0.6, they need ILM flap procedure. So based on this model, we did a small prospective study on 31 patients. 4 patients, they had MHI less than 0.35, and 7 patients, they had THI less than 0.6. ILM flap was done in all, and rest of the 20 patients, they underwent conventional surgery. So type 1 closure was seen in all these cases. So it is a very simple model to achieve very good anatomical and functional results and in the macular hole patients. And if MHI is less than 0.3 and THI is less than 0.6, the patients need inverted flap procedure. Thank you.